There's something in the air and it's called corona. So, corona, this pandemic that is all over the world, has practically taken over our lives. As a patient, as a person who wants something cosmetic, some cosmetic surgery done, is it appropriate for you to go and get it? Hi, I'm Kiran Naik. Let me try and answer that for you. Now, this is what the coronavirus looks like, something like this. Well, it's not so well formed, but it has all these spikes. And what it does is, it's there usually because some person has sneezed or talked loudly, it's there in the air or is sitting on your table somewhere. And either you inhale it inside or you touch it and then you touch your mouth or your eyes, and that's the way it gets inside your body. These spikes, they go and stick into the cells, it enters your body, it multiplies, and then it can do a number of things. The commonest thing that the coronavirus does is nothing. A large majority, 70% of people who get affected or get infected with corona actually have no problem whatsoever. The remaining 30, some mild symptoms usually, but in about 2-3%, it can assume serious, adverse effects. It can cause major organ damage. But the important thing is that the damage is not mostly because of the virus itself. The damage and the problems that arise, and this is important for us when we are talking about cosmetic surgery. The problems arise because the body, which doesn't know this new virus, reacts very badly to this foreign agent which has suddenly come inside and which it has no clue about, because this is the first time ever in our lives that this virus has come into existence. So, what about cosmetic surgery? Well, there are two things about uh, you know this topic. First thing is, will you get corona because you visit the doctor's clinic or the cosmetic clinic? I think that's practically out of the equation now. The lockdown is over, and you are, I'm certain, doing almost everything that you used to do before. You're meeting people, you're going to the mall, you're going to the shops, you're coming into contact with so many people. So the doctor's clinic part is not really relevant now. All you have to do is wear your N95 mask when you go there, and probably if you wish, you can wear gloves as well, and that's about it. Be sure that the clinic is taking some precautions, and that is, they are filtering out people, staff and included, and other patients by checking their temperatures, providing sanitizers, cleaning the surfaces. See that they are not crowding the premises, that they give appointments at different times so that you don't have to cross other patients. Those are the basic things all good clinics will do, and that's what you should look for. Now, the other most important thing is, should you undergo a procedure in these days, now that there is all this corona thing going on? You want a procedure, and should you do it? Is it safe? It is very much safe. There are two things. First thing is that this virus is not going to disappear. It's going to be there with us for our lifetimes. It's probably going to go and come back, and just like flu. It's there certain times of the year, it goes away, then a new strain comes along and we get the flu, and then we are fine. So corona is not going to go. It's probably going to do the same thing that the flu virus does, because they are actually cousins. They belong to the same family as the flu. So it's not going to go away. And well, if you're going to do the procedure now or later, the virus is there. The only important thing is that you need to be screened to see that you are not actively having the corona infection when you go for a procedure. Because, like I told you, 70% the chances are that you If you have the infection, you wouldn't even show anything to account for it. I mean, there's nothing which will make people, you or the doctor, know. So the best thing to do is just 48 hours prior to your procedure, you get a swab test called the RT-PCR. Also, cosmetic surgery patients are usually healthy patients. They are patients who do not have any other complicating issues, because if they had, they wouldn't be the doctor wouldn't be performing cosmetic surgeries any which ways. And hence, if you ask me, there isn't really much problem if you are a healthy patient with no other comorbidities, no other complicating issues. It's going to be as safe as any other time, unless you want to wait for a vaccine, take a vaccine, and then go for the procedure. But that might not be such a practical thing, and it's somewhat in the future. We don't know much about the vaccine. So, if you are healthy, if you are young, go right ahead. Just see to it that the doctor is taking all these precautions, doing the RT-PCR test for you, because that is for your safety. It is not for anybody else. And why is it for your safety? Because in case you do have an infection which is not symptomatic, which is not showing, the procedure might, just might, not usually, but just might actually increase the severity of your corona infection. So, all the best. Do not worry. Do go ahead with the procedure if you really wish to have it. There is no point in denying yourself that. Please feel free to contact me. If you have any queries, my contact details are there in the description on this video. So you can always call us up anytime and we'll try to solve your issues for you. Thank you.